Hi, this is Dr. Katie McQueen from La Hacienda Treatment Center, and let's talk about stimulants. Stimulants are substances that make you go fast. Your brain goes fast, your heart goes fast, everything goes fast. And they can be prescription stimulants, such as Adderall, Vyvanse, Concerta, that are usually used to treat ADHD. They can be prescription stimulants like phentermine that are used to treat obesity or compulsive overeating, or they can be stimulants like cocaine and methamphetamine, which aren't used to treat anything. Although some people say that they use them to self-medicate, but that's a different discussion, and I really don't believe in the idea of self-medication. Stimulants work by enhancing our norepinephrine, our epinephrine, and our dopamine in our brain, and that's what makes us go fast and think fast. Initially, it makes us do those things, but as time goes on, the effect wears off. And so we think we're thinking fast and we think we're doing fast, but the reality is, as time goes on, the effectiveness wears off. So I think the most important thing I would say about stimulants is that there are no good long-term scientific studies that show that medications that are stimulating are safe and effective long-term. Stimulants were designed to make soldiers fight faster and harder, and they really didn't care if the soldiers made it through the war. They just wanted them to make it through the battle. So the first challenge about stimulants is that they're addicting. The second challenge about stimulants when you're here in treatment at La Hacienda is that many people come in who are prescribed stimulants, but whose primary disorder is to something like alcohol or benzodiazepines. And they say, well, Dr. Katie, how come I have to stop taking my Adderall? I never abused it. And at first that makes sense, but there's a couple of reasons why we don't let people continue to take prescription stimulants. One is that it operates in the same pathway as other addictive substances, and so when you tickle that pathway, chances are you're going to want to go down it again with some other substance. So if alcohol was your substance before, using a stimulant increases craving for alcohol. The other reason is that I call this the Alice in Wonderland effect. So, you know, the mushroom, one side makes me tall and one side makes me small. And so many of us are living our life in addiction, especially towards the end, in which we're constantly trying to balance out the substances so that we feel somewhere near normal. It's an impossible task. But people who use stimulants have a tendency to abuse sedatives down the line. So the stimulant is good during the day, I'm feeling productive, but now I'm kind of wired and I need something to kind of let me down. I need something to help me sleep. And so now I crave something like alcohol, Xanax, Ambien, in this attempt to get balance. But balance is an illusion. It doesn't happen through prescription addictive substances. Balance happens through recovery work. And La Hacienda specializes in recovery work and helping to restore balance.